Does back pain bother you? And your doctor told that you have a slipped disc? Stop worrying. To understand what is a slipped disc, you need to learn basic anatomy of your spine. The human spine is made up of spinal bones, called vertebra. The vertebrae are stacked on top of one another to create the spinal column. The spinal column gives the body its main upright support. The neck, called the cervical spine, is curved slightly inward and made of 7 vertebrae. The back, or thoracic spine, curves outward and has 12 vertebral bones. The low back, also called lumbar spine, is curved slightly inward. The lumbar spine is made up of the lower 5 vertebrae, often referred to as L1 to L5. The lowest vertebra of the lumbar spine, the L5, connects with the sacrum, the triangular bone at the base of the pelvis. If we take a single spinal segment, includes 2 vertebra, the intervertebral disc in between, and the 2 nerve roots on either sides. The intervertebral disc is made of 2 parts. The center, called nucleus pulposus, which is spongy, and acts like a shock absorber to cushion the force between each vertebrae. The nucleus is surrounded by a series of strong tissue, called as annular fibrosis. The nerve roots, from the spinal cord, is passing on either sides of the vertebra, through openings called as neural foramina. Disc degeneration, or any injury, can cause the nucleus of the disc to herniate through the weakened layers of the outer disc, and leak out into the spinal canal. In the case of a lumbar disc herniation, it's underneath the spinal nerve root and can put direct pressure on the nerve. The nerve root extends down the leg. So any type of pinching or pressure on the lower spine can cause pain, numbness, tingling or weakness to radiate along the path of the nerve down the leg. However, many people have shown a disc bulge on MRI scans yet have no associated pain. So not all disc bulges will cause symptoms.
It's a big lie that all disc herniation should be surgically removed. In most cases of back pain, slipped disc is not the only reason for pain.
Along with a slipped disc there could be inflammation, muscle spasm, degenerative changes, contusions, rheumatism, anatomical changes, weak and lighter bones, dehydration of the disc, osteoporotic changes, etc. at the lower back. A few of these, or the entire factors can together contribute pressure on the nerves and create symptoms. Disc degeneration and related bulges are part of deterioration due to age progress, just like graying of hair. There are millions of people of various age show disc slip in the MRI, yet having no associated pain. So the whole point is, you might have a slipped disc but still can remain painless if you could treat all those underlying factors effectively. Our Medicare focuses to solve not only the slipped disc but also all the reasons behind, and thereby helps you avoid a complicated surgery. Our treatment procedures with heating, oil application and manipulative massages etc. are proven effective in all low back patients. Our treatments can relieve muscle spasm, reduce inflammation, rehydrate bones and disc, nourish the tissues around, improve flexibility, reduce stiffness, prevent further degeneration, manage rheumatism, lubricate the joints and thereby bring you perfect health.